Dr. Sangvi. Now I invite our next speaker for the session, Dr. Edward Kondrot.
Good afternoon, everyone. I would like to thank the organizers of the Congress for the opportunity to speak at this wonderful meeting. And my topic is eye disease from a homeopathic perspective, but my emphasis is going to be on suppression. And this is based on over 20 years as practicing as a homeopathic ophthalmologist. And first I want to thank many of my esteemed Indian teachers which have helped me through my homeopathic journeys and helped me acquire some of the knowledge I have today. Dr. Ramakrishna from Madras, Dr. Jewel Kishore, Dr. Mazumdar from Bombay, Dr. J.S. Shah, and Dr. Rajan Sankaran. And it was over 10 years ago that I was here in New Delhi studying with Dr. Jewel Kishore. And it was really a wonderful experience, and it's really an honor for me to return to New Delhi after over 10 years. And this is where I live, Phoenix, Arizona. And it's a very mountainous country. And Arizona is a unique state in the United States where physicians have a homeopathic license. Medical doctors can acquire a homeopathic license, so there's a lot more freedom in Arizona to practice homeopathy. So there's a dramatic increase in eye disease worldwide. And why is this happening? And possibly can homeopathic laws explain this increase? According to the American Academy of Ophthalmology, many eye-related problems are expected to dramatically increase from 28 million today to 43 million by the year 2020. And I'd like to share expression or suppression as an explanation for this. Conventional medical treatments are causing suppression, and homeopathic principles can explain why this increase in eye disease is occurring. The pharmaceutical industry is a big contributing cause to this, and many of eye diseases are related to suppression produced by modern pharmaceutical medications. We have antibiotics for conjunctivitis. There are steroids and antibiotic used for chronic blepharitis, which is inflammation of the eyelashes. We have steroid eye drops, which are overly used. Cataract surgery in itself can cause suppression. We also have laser surgery and intravitreal injections for various retinal pathologies. All these are causing serious suppression and leading to more serious diseases in our patients. Steroids are probably the most commonly prescribed drug to treat infections and inflammation in all eye diseases. And there are many side effects listed using steroids, but from the homeopathic perspective, these are not side effects, but I believe they are the result of suppression. And let's look at some of these suppressive symptoms. There's an increase in intraocular pressure. And sometimes glaucoma can develop after the use of steroid eye drops. Cataracts are related to steroid eye drops. Infections, herpes simplex, and ulcerations, all related to steroids. Antibiotics also. Overgrowth of new organisms can retard healing of the eye. Get inflammation of the cornea, erythema, edema, lacrimation, and itching. And here's an example of a purulent conjunctivitis. And the most common treatment that the traditional ophthalmologist will use will be a steroid-antibiotic combination, much like putting steroid on an eczema patch or a skin lesion. What is happening? The disease is pushed deeper into the body. Another example of a stye or a chalazion on the eyelid. Traditional ophthalmology treats this either with an incision or steroid antibiotics. Both of these are causing suppression, not looking at the underlying cause, and it goes against homeopathic laws. So let's look at the eye anatomy, and this may help us to explain how this suppression occurs, and how Hering's law may play a role. The superficial part of the eye is the cornea or conjunctiva. It's much like the skin on our body. Deeper in the eye is the iris or choroid. This is the vascular layer or the middle layer of the eye. And then the inner layer, or the deepest layer, is the neurological layer where the retina and optic nerve. And we have to look at these layers and correlate these layers to Hering's law. And here we see a normal eye. On the front surface, we have the cornea and conjunctiva. As we go deeper and deeper into the eye, we end up to the optic nerve and the retina, which is part of the neurological system. So as disease is suppressed, disease is pushed deeper and deeper into the eye, causing more serious problems. Let's look at macular degeneration, which is at epidemic proportions in the world. Symptoms of macular degeneration: loss of central vision is usually slow and painless. Central blind spots or scotomas, and the symptoms are usually bilateral, occurring in both eyes. Findings on the eye examination are pigment changes, drusen or little warty-like growths, and areas of atrophy of the retina. And you can see on the left is a normal appearing retina, and on the right are some pigmentary changes and hemorrhage which occur in macular degeneration. As a homeopathic ophthalmologist, I'm able to look inside the eye with my ophthalmoscope and carefully study these pathological changes and correlate them with an appropriate homeopathic remedy. Also, this is a slide illustrating the wavy changes of distortion that occur with macular degeneration. Here's another example of drusen, or these warty-like growths that occur in the back of the eye. And here's a slide with a hemorrhage in the eye. All of these give particular characteristics which might lead you to the appropriate homeopathic remedy. Now let's look at glaucoma. There are two types of glaucoma: open angle, which is much more common, and closed angle. This occurs when there's an increase in pressure inside the eye. We measure the peripheral field because in glaucoma, because of pressure on the optic nerve, you lose your side vision. And you can see this slide here illustrates the loss of peripheral vision. We also have damage to the optic nerve in glaucoma. Diagnosis of glaucoma is based on elevated eye pressure, although not always. There's a condition called low tension glaucoma. And glaucoma really is not a disease of pressure, it's more of a disease of circulation of the optic nerve. Usually you have visual field changes, loss of peripheral vision, and changes in the appearance of the optic nerve. Glaucoma eye drops. Are they side effects or suppression? They can particularly be suppressive when used to lower the intraocular pressure. You know, glaucoma medications suppress the natural production of aqueous humor, which is essential for transporting oxygen and nutrients to the eye. And it's a rather simplistic approach that ophthalmologists take in using eye drops to lower pressure, when in fact glaucoma, I believe, is a disease of the central nervous system. It has to deal more with the circulation of the optic nerve, and this is where homeopathic remedies can have a wonderful effect. Cataracts. Here's a picture of a cataract. And the most common operation in the world is cataract surgery, and there's some good evidence to indicate that cataract surgery can be suppressive. There was a study that was published in the American Journal of Ophthalmology that indicated that there is a 1.7 times higher incidence of macular degeneration after cataract surgery. Why does this occur? Because the underlying problem is not treated properly based on homeopathic principles. The cataract is removed, and what happens? Based on Hering's law, the disease is pushed deeper into the body. So the person then will develop macular degeneration or a more serious eye problem. I always like to refer back to an article that was published in the North American Journal of Homeopathy in 1891 by Dr. Norton, Homeopathic Treatment of Incipient Senile Cataracts, 100 cases. This was a retrospective study. He looked at 295 patients. 100 patients were under treatment for greater than 3 months. And he had an improvement in 58% of the cases and no change in 42%, which is remarkable because cataracts do not improve over time. They usually get worse. And it's always been alarming to me especially in the United States, to see the number of unnecessary cataract surgeries that are performed. Typically, in the U.S., when a patient gets some early visual complaints, they're really not limited in their activity, they have cataract surgery. And then 3 to 6 months later, I see a more serious problem like macular degeneration. In Norton's studies, these were the top 3 remedies he used to treat cataracts. Causticum was number 1, calcarea phosphoricum number 2, and sepia number 3. Other cataract remedies that are friends of mine are Cineraria maritima, which I use in an eye drop form, and naphthalinum. I think that because of the increase in the amount of our use of coal tars and pollution, a lot of the carbon remedies now are becoming very prominent in treating many eye conditions. For a non-ophthalmologist, sometimes it's difficult to get the right homeopathic solution in treating eye diseases, because most of our eye pathology is poorly represented in the materia medica and repertory. Now, since the eye is derived from the neuroectoderm, you need to look at the skin section in the repertory, and this has great value. A lot of times this can be help you with some keynotes to help you with your particular eye problem. Also, symptoms are associated with certain organs of the body, such as the liver, can be valuable in helping search for the right remedy. And also, emotional states associated with eye disease are very helpful, and the use of the generalities chapter. These have all been instrumental in helping me select the right homeopathic remedy. I'd like to just talk about a couple of illustrative cases. This was a 57-year-old radiologist who presented with a sudden onset of blindness in the left eye, very loquacious and pressured speech, gets mad very easily, and he has a peculiar symptom that his vision is better in a dark room and worse in the light, which was kind of odd. He has a 5-year history of insulin-dependent diabetes. Physical exam revealed fairly normal vision in the right eye, and he could barely see light movement out of the left eye. And the left pupil is slightly larger, and there's no afferent pupillary light defect, which would indicate damage to the optic nerve or a central neurological problem. And this is his fundus photograph, which is classic for a central retinal artery occlusion, which is a devastating event. And I was taught in my ophthalmology training that there's no cure for a central retinal artery occlusion. It's irreversible. The best hope is to protect the other eye. Homeopathic treatment with Bothrops 12C twice a day was prescribed. And the patient had complete return of vision in 3 days and is doing well 2 years later. I know I always question, why did you use 12C but not a higher potency? Well, that's all I had was 12C. I would have probably used a higher potency, but the 12C worked very effectively. And George Pascholkis states that this remedy, together with Lachesis, Arnica, Latrodectus, Bactins, and Lycopodium, should be our main remedies for coping with the first hours following heart infarcts and brain thrombosis, and this was a thrombosis of the eye. Amaurosis is a strong symptom. Day blindness, and this was a characteristic keynote he had. His vision was worse in the day and better at night. The next case is a 78-year-old female with macular degeneration, cataracts, and balance problems. The vision is very dim, and she has trouble reading and dancing. She has vertigo and ringing of the ears, and very, very disabled. You can imagine having vertigo, cataracts, and macular degeneration. All of her visual, all of her sensory symptoms are affected. She's also very weak. An important aspect of her life was ballroom dancing, and her sexual drive was never very high. And her vision was markedly reduced in both eyes. She could almost see the big E in the right eye and the left eye. She could only see letters when she was 3 feet from the chart. She had advanced cataracts in both eyes and myopic degeneration with atrophic changes in her retina. And homeopathic treatment, according to Norton, Dr. Norton in his article, sepia is the #1 remedy to think of in females with advanced cataracts, and I gave her LM potency of sepia. And 8 months after which, she can read the menu now at the restaurant. There's about a 70% improvement of her vision. Street signs are becoming clear, no more dizziness, and she's back to ballroom dancing. which was a real joy, and there's no more ringing in her ears, and now her vision has improved to the second line on the eye chart, which was very nice because this afforded her a nice level of functioning vision. Now, I'd like to go over the top 12 homeopathic remedies for the eye in my experience. And what I did is I looked at all of my charts over the last 20 years, and I came up with these 12 remedies. And these are in alphabetical order. They're not in order of incidence. And this talk is available online if you go to my website, healingtheeye.com/Liga in capital letters .pdf. Arnica, as we know, is another number one remedy for trauma, and also it's a great remedy for the eye, especially with trauma, ecchymosis or bleeding in the eye from coughing, and it's also a good remedy for retinal hemorrhage. And there's an example of a subconjunctival hemorrhage, and the first remedy I think of in a subconjunctival hemorrhage like this is arnica. Aconite is also a big remedy for the eye. And the interesting thing about aconite, I have found it very successful in treating symptoms after corneal laser surgery. You know, there's a lot of LASIK going on and photorefractive surgery. And it's interesting, the laser that is used for these operations uses ultraviolet light. So in patients that have a lot of pain, discomfort, and problems, aconite is a remedy that should be thought of. Belladonna is a very big remedy, especially when there's a sudden onset of symptoms, pupils dilated and sluggish. It's a remedy that just covers every aspect of the eye, and belladonna has been my good friend over the years for treating a lot of severe eye problems. A marked elevation of pressure in glaucoma, retinal congestion, venous stasis retinopathy, optic neuritis, and iritis. It's a great remedy. And here's an example of an early branch vein occlusion and obstruction of the vein of the eye with hemorrhages. You know, when you get this angry red appearance inside the eye, you know, I think of belladonna, especially when the symptoms come on quickly. And here's the proptosis of the eye, the protrusion of the eye that you see with belladonna. Euphrasia is an excellent remedy for superficial conditions of the eye, lacrimation, and it has the peculiar symptom of the acrid or burning discharges from the eye to compare with Allium sepia or the onion, which usually has a bland discharge from the eye. Mercurius is a big remedy for vascular keratitis, keratoiritis, retinitis, and also acrid discharges from the eye. And here's an example of keratouveitis. Phosphorus is another big remedy, and typically when a patient has a lot of visual symptoms, complaining of lights and flashes and color, they go into a lot of detail, I'm always thinking of phosphorus. Pulsatilla, another remedy for conjunctivitis, obstruction of the lacrimal duct, and it has a characteristic yellow-greenish discharge, bland and profuse. And this, along with Staphylos aureus, is a good remedy for styes. Rus tox is a great remedy for inflammation of the eye. In Dr. Norton's book, he covers a really interesting case of a marked panuveitis, or massive infection after cataract surgery. It was felt that the eye was lost, and Rus tox cured the case. So this is a remedy I think of when there is a very purulent infection after cataract surgery. And there's an example of that infection inside the eye. It's a hypopyon, which is an accumulation of pus inside the eye after cataract surgery. Ruta is a great remedy. We all know it for treating tendons and inflammation, but it's also used as a remedy for sore eyes, difficulty after reading, and disturbances of accommodation or focusing. Silica, number one remedy to think of in nasolacrimal obstruction, especially in newborns. Symphytum is called the arnica of the eye, and a lot of times I find this very difficult in the differential. Is it arnica or symphytum? But there seems to be more of cataract problems after injury with symphytum than arnica. And here's an example of an injury. Staphylos aureus, we know, is a big remedy for styes. And also I find it a remedy for problems after incisions in the eye. Years ago, there was an operation called radial keratotomy where incisions were made in the eye to flatten the cornea for myopia. Staphylos aureus was a big remedy I found useful in post-op complications. It's also used to treat styes. Sulfur, chronic problems, blepharitis, inflammation. Also petrochemicals, carbonium sulfuratum, benzenum, dinitricum, paraxylquonium, naphthalenum are all remedies that I have found useful for many eye problems, especially macular degeneration. So in summary, the increased incidence of eye disease is related, I believe, to suppression. We need to understand this and Hering's law. The eye, remember, is derived from the neuroectoderm, so the skin section of the repertory can be very helpful. And homeopathy is very valuable in the treatment of eye disease. I'm in the process of publishing a book called Homeopathy and Eye Disease to be released in 2012. And I'm looking for eye cases. So if any of you have interesting cases, please email me with your case, and I would be happy to give you credit, but I'd like this to be a compendium to bring many ophthalmologists up to date in the use of homeopathy to treat eye disease. So thank you very much. Person, but homeopathy can be very, very effective in treating the symptoms of dry eyes. And probably any one of the major polycrusts. I've had success with aconite, sulfur, mercurius, euphrasia, all these remedies. But typically, if I'm not sure of the remedy, I often recommend euphrasia in the form of eye drops, and also maybe like a euphrasia tea, and have them use that as a compress on the eye.
The people are very much careful about the eye diseases. His nature of boldness to take medicine with the full confidence and prescribing for the cure of the eye diseases, not only as a local disease, he is going to express his feeling to consider patient as a whole. His holistic approach to the treat eye diseases, and especially I congratulate that his experience, especially regarding the indications of these 12 remedies. I appreciate, I too have got very good result with the naphthalene. I again congratulate Dr. Kondrot, and I hope the other features, other people are going to work in the line of these eye diseases, because after a good amount of a long period, after Norton, we have heard a beautiful experience of the eye diseases and their result with the homeopathic hand. Thank you, Dr. Kondrot. Now the last, in the case of the post-traumatic